Well, moving on, and in Sierra Leone, schools are due to reopen after being closed for about 8 months because of the Ebola outbreak. A 3-day lockdown to curb the spread of the virus has just ended there. Well, earlier I spoke to a senior policy advisor from the charity World Vision, Johan Eldebo, and started by asking him if the measures against the disease were working.
I would say that we're winning the battle against Ebola at the moment, but we're not there yet. So we have managed to contain the outbreak. The number of new cases last week in Sierra Leone was 33. In December last year, we were at 550. So enormous progress has been made, but we're not done yet.
Do you get the sense, and I mean, you know, you're obviously there, you're talking to people all the time, and so therefore you're constantly involved in it, but it's sort of slightly moved off the news agenda and it's out of people's consciousness?
Yeah, sure. I think when you look at the world today, there are a number of big crises happening at the same time. So keeping attention on any one crisis has been difficult, and the most dramatic phase of the outbreak may be over at the moment, as it looks now. But people estimate that up to 10 years of the development of the region has been lost. So there's a long, long way to go to get back to normal. Yes, let's talk about the children, which is really your World Vision's remit, is the children. 8 months without schooling. How are they going to catch that up? That is going to be a challenge. We've been speaking to people in the UK and imagining if people here were not to be in school for 8 months, it would be a huge problem and a big challenge to get people back to the level they were at before. In Sierra Leone, it's going to be an even bigger challenge with a very limited education system to begin with. So we're working with the government, we're working with other partners in the region and in the countries to make sure that we can resource the catch-up programs and make sure the children can get back to school in a safe way. And reopening schools in a way that is safe, where people can come back without fear of further infection, is one of our key priorities at the moment. But indeed, but in terms of learning, they're 8 months behind. So will schools be open for longer and for more days? I think the exact details on how to do this is still being developed, but the key challenge is to make sure that the buildings themselves can be used for schools rather than medical purposes, that we can have teachers back in place, that children can come back to school without being scared of getting sick, that the parents can feel safe, that the children can actually be there. I mean, fear is one of the biggest reasons for why it spread so fast, fear and ignorance. What are you doing? Are you working with the faith leaders? We are. We've been working in Sierra Leone for more than 20 years now, so we have a very well-established community-based program where we work with faith leaders, we work with other community leaders to bring training on how one can bury relatives and people who have died from the disease safely in a way that both limits the risk of infection, but it's also a way that is safe and acceptable to the people themselves so that they can own the process. Well, give us an example of the difference and how people can still own the process. But what is the difference between the old way of burying people and the new, safer way? Some traditional ways of burying people has been where you wash the dead body as a way of honoring them. But that the act of washing means that you touch a dead body, which is one of the ways where you can get infected with the virus. So finding ways with the actual washing and the touching of the dead body doesn't happen, is one of the ways that we are working with community leaders to show them what the ways are that they can get infected, but also finding ways that are culturally appropriate for doing the burials without risk of infection. And now, what about orphans? I mean, there's a real problem with orphans in as much as a lot of their sort of more distant parts of their family don't want these orphans if their parents have died of Ebola because they're scared. Yeah. I mean, there are several thousands of orphans now. We're working to see exactly how many they are, but even finding the number of people who have been orphaned is very, very difficult. So we're supporting orphans that have been left on their own, but also trying to educate people on how the risk of infection happens, which means that if one of your relatives has died from Ebola, that doesn't mean that you are infectious, which is one of the misconceptions on how the disease actually spreads. It's all about misconceptions. And we heard earlier on at the beginning of the outbreak, how organisations like the Red Cross were doing plays and radio plays and doing it through play and plays. Is that one way to communicate and try and break down these superstitions? Yeah, I mean, finding ways that people can receive information is one of the key things. Having the right information is not in itself enough, but finding ways to communicate it in a way that gets received and acted upon is one of the key ways we find in terms of engaging with communities, where one thing might work in one country but not in a different one. Indeed. They've had a 3-day lockdown in Sierra Leone. Are we likely to see some good results out of that? Yeah, this lockdown, or stay home as they call it now in Freetown, has it's been in place for 3 days to allow health workers to visit homes of people and to see if there are people who are infected, and then to show people what to do if they think they might be infected. So far, it's too early to tell exactly what impact it has had because it ended, well, today. Earlier outcomes have been, in some ways, positive, where some people have been identified, people have been able to be educated on how to actually handle the virus. But